chapters you should be focusing on. So Wong and ATI for your communicable diseases and immunizations, and for cardiovascular. And like I was just saying, I think ATI chapter 20, what it focuses on and the defects that it discusses, I would focus on those. With, again, using the Wong book with the pictures that are in color, I think is actually really helpful. In addition to that CHLA website, which I think helps a lot. Really quickly with immunizations, you guys do need to know specific ages at which you will give whichever vaccinations. There will be questions like, you have a 1-year-old who comes in, what will you anticipate telling the parents, like what immunizations will you be anticipate telling the parents that you need, or a 4-year-old, or even a 12-year-old, or a 16-year-old. So make sure you're familiar with all those vaccines. I know it's a ton to memorize. If there's like a mnemonic you want to create, if that's helpful for you. I know Professor Dyer, I think, provided a website that helps with mnemonics. Just remember that the P's don't always necessarily stand for P. Like sometimes P is like, I don't even know what, but just remember that, be careful with the letters. And then, like we were talking about earlier, refer to ATI for the contraindications and precautions, because there's probably going to be one question about whether it's pregnancy or ag allergy or something like that. You might have a question like that. Oh, this is the website, Picmonic. It's like a way to remember some of the vaccines at which ages. But the CDC website is the one you have to have memorized. Definitely know which vaccine gets given at birth, and definitely know which ones get given at 1 year and probably 4 to 6 years. Airborne precautions, remember it's varicella. So if you're on airborne, it's measles, TB, varicella, right? Knowing your types of immunities, your vaccines, what you need to document and educate about in terms of immunizations, what kinds of information you have to have ahead of time. You always have to have consent for immunizations. You always have to document the expiration date, the manufacturer lot, the dose, the place you gave it, whether you had consent, all the things you need to document when you give immunizations. We talked about before precautions versus contraindications. These are all the different immunizations and illnesses you can get. I feel like this is kind of repeating what we need. Just remember when they get these and maybe what sort of precautions you would use. Education about vaccines. There probably will be a question about a parent who comes in who says they're afraid to give vaccines to their child, and how do we educate them on why it's important to get vaccines. Let's see. Don't forget your other communicable diseases, like Zika, like parasites, like bed bugs. I'm not sure if there'll be questions on those, but you might want to be familiar. Conjunctivitis is a symptom of some of these diseases. So this is yeah. So this is the picture of the heart at birth on the left, and then the heart, what it's supposed to look like after birth. And this would be a normal heart on the right. Be really familiar with this, what this is supposed to look like, so you know what the defects, the issues are. I would know all the defects, or at least be familiar with them in chapter 20. It's helpful to know how they're classified, whether they're increased pulmonary blood flow, obstruction, decreased pulmonary blood flow, or mixed. into those, you can kind of get a better idea of what the issue is. Is the issue that you are getting too much blood flow to the lungs or not enough blood flow to the lungs? Or is there something that's like obstructing the flow of blood from, the ventricles into the pulmonary system or into the aorta? Definitely visit that CHLA website. It'll help you with simple descriptions of each of the defects. If you didn't already do your case study with the infant with diaphoresis when feeding and figure out which of the defects that baby has, chapter 20 can help you with that. Also know what diagnostic tests you might need to diagnose heart defects. The book talks about chest x-rays, EKGs, echocardiograms, and cardiac catheterization, which we just talked about. These are the 4 classifications, and this is if you can remember which of these defects fits into which classification, like I said, I think it's really helpful. So you've got your ASD, your VSD, your PDA, which lead to too much blood flow into the pulmonary system, right? Or you've got your coarctation, your stenosis. Those are obstruction. So you're not getting enough blood flow out of the ventricles. Then you've got your tetralogy of Fallot and your tricuspid atresia. Those, you're not getting enough blood flow into the pulmonary system, right? So you can't get oxygenated blood as well. So that's why it's like cyanotic defect. And then your mixed, which are your transposition, total anomalous pulmonary venous return, truncus arteriosus, and hypoplastic left heart. Okay? Cardiac cath, we talked about pre-procedure, post-procedure. Definitely know what your nursing considerations are for both. CHF, hopefully somebody in your class did a little presentation. I think usually you guys do that on CHF, but congenital defects can lead to CHF. Heart problems, other diseases or sicknesses or illnesses can lead to CHF. And essentially, it's just not sufficient cardiac output to handle what the body needs. And then, the child's circulatory and metabolic needs go unmet. And then the heart starts working really, really, really hard, trying to get blood pumped to the body, which leads to a bigger heart, which leads to heart failure. So definitely be familiar with like the signs and symptoms of a kid with CHF. Digoxin we talked about. There'll definitely be questions about administration, how to give it, when to hold it, what to do if the child throws up a dose. That's usually a question. This is a different page on the CHLA website, and it specifically addresses heart failure. So I would definitely encourage you to go to this one. It's like, it just discusses heart failure. So what causes it, what the symptoms are. So this is, and what diagnostic procedures you use. So I think that's really helpful. Signs and symptoms of sepsis and shock. I don't know if you guys discussed that, but maybe review that as well. Kawasaki, you'll for sure have a question on Kawasaki. Signs and symptoms, interventions, aspirin dosing. There'll probably be a question about aspirin dosing. And rheumatic fever, we already talked about. We talked about SVT. So these are just a couple other topics that you may want to spend some time reviewing, but especially Kawasaki and rheumatic fever, for sure. I would do any case studies that are in the book or in ATI. Like I said, the cardiac cath, it's case study in ATI. In the book, in Wong, there is a case study on a child with heart failure. There's one on the child with coarctation of the aorta / heart failure. It's on page 750 of your Wong book. I would highly suggest you go through that. I think that's helpful in studying for sure. You'll definitely be asked questions on at least a couple of the heart defects. Usually tetralogy of Fallot is the most common, so you might expect a question on that one, and definitely one of the septal defects, like a VSD or ASD. I created a practice quiz for week 3. It's got vaccine questions and it has heart defect questions. Here's the ID and password. It's got 30 questions. So hopefully that should help you guys study a little bit. The explanations, the rationales are enabled. So I would highly suggest you read all the rationales for the questions you get right and wrong. How's that? Is a good, helpful study tool as well. Somebody asked me to go back through the slides one more time, so I'll do that, starting from the beginning. So these are the chapters you should be familiar with. These are some immunization topics to review. More immunization and diseases to review. Communicable diseases. And I think if everybody's got those. And then there's the quiz. Any more questions with our last minute? If not, good luck, you guys. I hope that was helpful. And good luck.